viewers, welcome once again to today's show. This is WTV Consulting Room, where we have your free health consultancy discussion. And you know that as usual, we engage very seasoned health professionals with a lot of experience to address the issues that affect your health, so that they would empower you know which condition you need to intervene at home, when you need to go straight to the hospital before issues escalate. And sometimes you know that you have issues you want to discuss with very professionals. That is why we are here. And can say, and then so nyame adomo ye na me de biara no 95 ekopemu no nsia e WTV Consulting Room bia ye ne akuku danwo apomodemu edi nkomo se ne be ya normal etete wo behu ne wo so de ko ayaresabia entem ene nia ehia se ebia e wo se wo yehu bibi e wo fie nti wonim say eba ne say ya na enye me nko a me ne wo nyinara, so you had opportunity to ask questions, make some contributions na bibi biara nso e kire wa adwen bia no eno nso obetumi e de atodwa emra ye ba beka enkomodie yi a ye wo no enede yi a ye besade ye telephone numbers no nso atodwa na wonim say eba edwadie dia ene na WTV Consulting Room any WTV jumedi a ye di nyinara no ye boa emma ne a woton biara no utumi nya atofo enu nti bre na bra na ye ntumi emboa wo advertise wo programs any normal we ye ni ejuma wudie se ne beya ubenya atofo bebre enu nti twen me enko baabia. We're going to be right back. I would introduce to you the guest for this evening's discussion, when I would also add the topic for this evening. So please just stay seated and we're going to be right back here. Thank you very much.
Therefore, ade ache bio ye call ye na so ye koda ye rade adomu nti ye nyina ya sorry emofra akọ omusuku adwumayefo so kọ omunyuma so se wo son da yo se wan son da yo ye ka kire sorry na shere sorry na shere dwumadie ya no pabosu dwumadie bi a ye de bre yen se de be ya ye betimi enyini ewo hunhumu na yenyi ohunamu ne mpo etimi yenyini ewo adwene mu se de be ya yenyina betimi akyekyere man na ya akyekyere asafo na afi kra yetimi akyekyere busua
ye behwe nsem a ekoso oman Ghana mu eni wiase afa na nyina
ye befa nsem yi efi ko wankrata mu ene abefo internet so
anape bia ye nsem a ema enidaso eni insatwaye ebebre ye de onyankopon asem bebre na ya hweso e de aboye bra afi kan ye hu anape bia na ye mfa enije nsem embre
eni nti afi kan ye hu
Anita Kwaku
ene Reverend 𝗟𝗜𝗩𝗘 Agbomen ewo Wesleyan TV so afi obetimi ahwe won WTV Ghana ewo Facebook so na afi Wesleyan TV Ghana ewo YouTube so sorry na sharing
wake up to a purposeful day.
Jumadie aboafo bi te se
All Insurance, multi-credit savings and loans.
Ana Methodist University Ghana ana aso yasen.
There is always a story on the train of national discourse, a host of thorny issues begging intelligent analysis and unbiased scrutiny. But how do we interrogate these matters? Through the regular lens of partisanship or through a spectrum that focuses on the national good? The answer is the latter, and that is why the state is here. Here on the state, we turn our backs on the political gimmicks, ignoring the endless propaganda and opening our doors to honest and critical assessments on all matters of national interest. Our focus is to generate compelling solutions to the litany of problems in education, politics, health, governance, the economy, and all other areas of national life. We also bring you closer to the narratives on the streets, bringing you up to speed with the voices of ordinary men and women who cannot be heard. It's a platform of truth, objectivity, and impactful Christian-centered engagements designed to better the lot of all and sundry. Join me, 𝗪𝗪𝗪𝗘 khi_HiShand this and every Monday, Wednesday and Friday on Wesleyan TV for this all-new current affairs program. For sponsorship, please call 059-311-0733 or 025-625-3461. The State, probing the issues, digging the solutions.
Wesleyan TV, reaching out to the world.
Enunti medamasi bebre se wetimi enya abotre ede atwen ye Unyaba Rose Aduful ena ene nyame adom yasehie mo ha se aye hwe noma ebetume amaye nimde efa yen apomoden ho na ene se nyame amaye enkwane de na ehu hia se ewo se yehu bibi na ene yen adusuade no eye ade a emu dori bebre empempi no ebi wo ho a yefa ne tra na eba ne seya na ne wieye no enye fe bebre enu nti na ene nyame adom ye mewo menua bema wo haseya obetumi aboaye ononso ewo Hollywood Teaching Hospital na no bia ohwe anase bebi oye ejuma is with the Ghana Institute of Clinical Genetics a trese addition dia anase bia yeboa won a bia wo go here ahodin bi ewo wo mpomudin bi ho ahodin bi wo mpomudin ho mempese meka no sisi ya esanse ono betumi aka de bebre enti na me bu ne sa no eno nti ye wo menua bema wo ha se ye friend Dr. Kwabena Opon Amoako Dr. Kwabena Opon Amoako na senya meka about clinical genetics and nature say na enne ne ba be hwe ne say yes sickle cell disease navigating the crisis sickle cell disease navigating the crisis and until Dr. Amoako nyamisha bebre set me yeton safre wo baye na minim se wo de emrele de enye adeketo eda homa na we are so grateful for honoring this invitation to have this discussion on this platform, so you are most welcome once again.
Thank you very much.
Great. Enti we de meka na Kwabena and said Dr. Kwabena Amoako say senior ya Canada say eneye sickle cell disease navigating the crisis ya ka sickle cells no ne de wo hen no.
Okay, enti medase say mama ya kwenya yi na yetumi aba na yetumi ni viewers edisa enkomo yi na sickle cell yare bi a edikan moja mu yare aha nti se na nipadua yenyina ye nipadua moja edi emu afrusani moja no ye woniema bebre we ye moja ni mu a omunyina wo role and say omo functions omo play nipadua ni mu na sickle cell yare a affect one component and say ye moja ni mu ade ba ko a ye friend red blood cell na won say ohwe ye moja na wo say moja gu for ma won say eni ye kokko na de na we moja ni ma ema eni ne ye kokko no eno no ye sa cell na ye friend red blood cell no na sa yare sickle cell ye yare a affect sa red blood cell into ye cause sickle cell disease a yare a affect ye moja specifically the red blood cell
we dey ye da bebre say yare affect ye moja and ye wo can set red blood cells na me hwe making can be kakra no can say ye fa bia emofra be se dumiensa tissue ne ye ebibiman mu ha say no utminya abofra ba ko bia owo sickle cell adentina ebietimi eba ne sa.
Okay, inti medase senia wodi kan no sa na tie sa yare affect your red blood cell yi wo hwe we ase afa na nyina nipa be 20 about 25 million persons in the whole world and they are affected by yare na titru ye ebibifo yare edi etene ewo ye mu pa typically no we find it in the African American population if you are looking at outside into young sub-Saharan Africa na ye kita the largest population or more sickle cell now the ba Ghana ha nhwehwemu mama ye hu say about 2% in Colombia ye wo mo warriors Ghana had afibia no ye mu 2% and now we mu 100 anawfa nkwala da ya wo mu e wo Ghana afibia emu mienu e wo saa yare sickle cell nti e yade ehu hia ye pa se ebetumi etu ho anamo na etumi esua de ne ehu se ne ebetumi ne saa yare yi atena nti yare ehu hia pa wo se obibia ema neni ebafo
adi ehu hia paasi etu ho anamom yedase doctor enunti sanse ya anamonto abepie mu yede yenya yenimu eni hospital yebeside hu den na ebetumi atwere se ebia na me sickle cell disease ana se obi sickle cell disease se ye hwe ne kind of signs and symptoms na yebeside ehu bibisa
Okay.
Yeah.
Okay. Very important question, Medase. Now, sa yare affect specifically red blood cell ya make ho asemi eho nsunsanso na se manifestations no egumu ahoro. Okay. Ena senia yare ne beda ne ho edi ewo enipa mu no ejina ade a yare no eye wo sa nipa no let me just say this in English so you can understand well. So the manifestation of this disease is it has varying manifestations. It to me is show and I say to me done ho different ways. Now yare to me cause problems be ema obi a o sa yare no na sa problems no ena ebema ye hu say yare no ena eda ne ho edi no. For instance, one of the things happen with sickle cell ne say esan say body no sa red blood cell yi ehun sebe atoche makakra ne nti no onipedua ne hu no say eyade a eni say wo ne moja ne nti obebubu ne ntem na ebubu a release bibia e friend no bilirubin na sa bilirubin eya efa ye jonso mu ana sebe eja epie na esan so mo sickle cell no omo body no break it down sa red blood cell in term and I say at a faster rate than what obi a oni yare ni bi ne be ye no eba ne sa na honam ne de bi ehyehyehye mia bebre ebi ni eni nti obehu say most of more sickle cell most of the time no ya no many aye yellow aye kind of brofo mu say jaundice no no another way so obetumi ehun say tembia na nipa wo sickle cell yi ni moja so ate tembia ye say just ye ma ni moja ye check ni moja san say honam ni ana nipadua ni hu say sa cells ya produce no ehun atoche makakra nti ma men say ni tembia sa ade no wo ho another way so yetumi hu say obi wo sickle cell no say omomo bebre no ya na they have problems with growth in some of them especially in Kuala no there's delayed growth once akolare as a yes we did 15 on social now should be about 7 years and also so one of the ways ayare no etumi dan ho edi ena esan say yare ni mujamu yare ni nti no another thing it I say say eya ye ka say omo ye susceptible and natural omo to me enya infections very easily than obi a oni sa yare bi nti tem bia bon say na nipa no o yare e was say de ne call hospital and I say say ne ko ye na sa yare no me say na me di kan kai 2% of all newborns have it. Now one of the first signs I heard enkwala almost sa yare ni bi no
doctor we the person ye ma senior wo kasa no ye tifo ene ye ahwefo no kra ebehu se ubo eni ase a ebia na ye yellow bibi te se
ye no na jaundice no na ye hu se akwala bia ne nsa mienu ahono eno ye frɛ no hand foot syndrome and dactylitis eno ye usually that's one of the first sign a ye hu ewo nkwala mo sa sickle cell no nti akwala bia be wo no ne maame moja kakra ewo ne mu a ebo ne ho ban ye wo nkwala moja na hemoglobin frɛ no hemoglobin F eno ba akwala no ho ban but udi 6 months ekona mo hu se na efi ni moja ni nti sa no one of the first thing ye hu se wo se ne TV ne ye che no na akwala ne nsa no ahono aye kese nti ye hu sa na ye were very high suspicion say this child likely has sickle cell disease.
Enti se wama ye hunoma se awofo ye ne ko ho entem ye wo ye mofra no we de ye da se bebre na enunti se ye hwe ne sie no ye besi dey sometimes se o can be to say bia na abofre bia we di be 7 years ba o hwe na so bia we di 4 years essence ontumi enyi yie enti se ye can the impact of this disease on our health ebi ne say nsunsanso ben ina enya woye nipa so se oye abofra se oye bema se oye oba and impact ebi ne say albetimi ne afemo
Inti sickle cell disease ni impact ni be describing no protocol mu say multidimensional. Inti one affect nipa na ono ankasa wo sa sickle cell yi. And also there's the impact on nebusia and there will impact on the economy and as on mine ankasa. Metrichem. Inti nipadua nankasa no the impact on only say one. So na me di kan kai no you so have manifestations like jaundice, there are problems with growth and all of that. One of the very common complications are a friend vessel occlusive crisis and as a pain crisis and the hallmark feature and as a editing and as a decaying say problem all red blood cell ninti na cells no and can say red blood cell near round but we na problem ninti na mana it say C and S nti ba ne sa na 𝗟𝗓𝗩𝗓 omo ho ewo ne nintini nkete ni mu ewo ne yefunu ne ndompe mu ne joints na poso eba ne sa na ona ya problem ne wo no it is so painful that sanipa na wo say ye de ne call hospital for some pain relief and that's very serious so ade no so to me see na hara we I cause be a friend acute chest syndrome and also so ewo ho na long term impact on the individual no yare we yare a etumi affect organ be a nipadua from your head to your toe. Yes, one of the common ones is the chances say ubenya stroke very high, especially even in omoyan kwala no kromu to stroke because moja no cells na sickled 𝗟𝗓𝗩𝗓 na ada eda wontini ni mu a etumi block it na cause stroke etumi cause problems we yeni friend sickle cell retinopathy nto be hu akwala o say be hu ade ye anapeni o say me hu ade ye eno yare no nsunsanso ye ba yakoma no so etumi cause be friend cardiomyopathy akoma na nkasa wall no be hu say na problems aba ho so ye sane aba ye funu so ye liver no etumi ma liver no ye kese friend hepatomegaly. Another one so yes splenomegaly and I say organ be we yefuni mu a friend is spleen and also ebo ye ho ban efi infections so moja to me kota ho bebre e masa problems neba yes neba form so a ye ba o kidneys utuminya long term kidney failure from sickle cell disease okay na yes na ye ba your reproductive area so specifically in bema no one of the common things ebinum tayenya ade friend of prapism na prapism yi a complication bon say moja na akogu obema sebe anka bema de anka no pe bia say obema sorry kakra and say uni oba hia but we no unwarranted unprovoked oba bia ne nye bibia kra na moja asane akogu ne bema na esan say sickle na SSC nti na 𝗟𝗓𝗓𝗓 sa na moja na ensan so ntumi mfi ne bema ne mumpie nti a obun said bema ne betumi gina so 2 hours 3 hours 6 hours e bitumi kwa as far as 12 hours when intervene it to me cause long term erectile dysfunction in bema sickle cell disease yes ania cause so na enan no another common complication sickle cell fonya dear friend chronic leg ulcers e kronya to ne nan no ho a e kro na nyen wuda 2 years 3 years ekwa na sanso aba se nipa na nteki ni serious so these are some complications obi o sickle cell otuminya by extension so yakọ na ebusuamu a esan na mekan no motai to me yare so one of the things I want to say nipa na ebusua tembia no mode esika yakọ hospital ene yagina to echina yase ye be ma ne moja ye beto edroway all these things economic burden we na ebusua emotional burden say de bia oba anase wunua ana o maame tembia other hospital atete ma omodwen another thing so to me see say as a nation also no oman eboka people who have sickle cell disease because tembia if they are always in the hospital there are some costs that the government has to take in draw wise any admission ni bibia so all these things are some of the impacts of sickle cell disease not just on nipa no or yare no but in the immediate family in the support system any oman no sebe nipa no okọ ejuma na say I say you to hospital 3 days 5 days na ejuma obeye no there's loss of productivity on that side so all these things are problems that come up when somebody has sickle cell disease na amonko na mo affected by mo nyina no
wow Dr. we dear nsunsanso dear ma me hokra adjo chesesa uwo obisa na se embebisa na se ebusuani bia enya wo maame na na se ejane nko a nipa na nkase mo ni ebusua no amma ne ba ma affect obia na adofo enkomo ye ayedi yempese obeyi ho afimu se ebia opese obisa asem bi anase opese oke bibia ode twro erenche yebe anase anase yebe ka ye telephone numbers no na wetumi afre na webisa asem na ne enkomo ene ye di ni nyinara no ye pese ye ma obia ete about sickle cells ye say ye hwe navigating the crisis and na doctor aka se empempi no yawo ana pain omukomo bebre enti enche ye behwe se ne asa yawo no omukomo a na ebetumi aye amomo eno nti numbers here enche be bono so no se wo WhatsApp a ubetumi asende ye WhatsApp line enti memma we mfi se share with screen so ubehu numbers na egu asiye no obetumi asene o WhatsApp anase nche ebie phone lines so an we bisa wonsem doctor ne me pese me bisa ne se wo ka fiti yeti ekopem ye nan ase onua o sickle cell disease etumi nya effect anase impact e wo so no sa enkrofo no omusiden live a normal life. How are they able to adjust to live a normal fulfilled life like abia many women no omusiden eyenasa say school course ejuma osiden eyenasa.
All right, so first and foremost no I must say living a very normal life with sickle cell disease is very much possible. Very possible say who a sickle celler you can live a normal life as every other person who does not. Okay, I work with people who have sickle cell disease. So the eldest patient I've seen is in the 90s.
Amazing.
We have people and I on Kofua or more sickle cell. Every Tuesday, our sickle cell clinic. We run an elderly clinic. You see people in their 60s, 70s come to clinic. Okay, so living a normal life with sickle cell disease is very much possible. The first step I say nipa or sickle cell I would take it towards this question is say you need to understand that or agree or appreciate the fact that you have the disease. Most of the time, the mental barrier that people have to break to admit that they have the disease is challenging. For example,
mental barrier na
I can say nipa no onjin tu mu say or yare no. Okay, so ebia mama ana papa or se media meba no ontumi nya sa de ni bi da. Nti anamo anka eso utu odi akwala ne beba ye be enroll no ye be lab ye be check say bia e fine ye de akwala ne beto edro so ana say ono anka sa be fe edro ana say no a lot of people don't do that. Nti onto ho anamo till say some of these complications here amabobo so ye bia start. Nti ye free one of the complications AVN nipa no jonko na shoulder and our hip joints the joints can be destroyed because of the disease. Nti obi wo yare no onto anamo till say or start say oti pain bi won hip mo and so ne ba kohwe mo am be test be brand no me say or sickle cell enter say indusa no na bia na yare no the process no are very advanced. Do you understand? However, right from newborn in Kolebo, we have the newborn clinic. Right from the newborn stage, we can enroll you. We follow you up, regular reviews. There are some medications I'm sure we'll talk about that help people who have sickle cell to reduce the number of times crisis and complications. And as a bad, the severity but if you don't first admit, say now over spiritualizing, say maybe enter say be too late. So that's the first thing. The other thing to say, I want people to understand that it is a medical condition. It is not a spiritual condition. So there are people who have been trained, hematologists, nurses, doctors, lab scientists, who have undergone training to manage these diseases, and they are managing people very a year or more live as much normal life as possible. First step is to to and among no other hospital. Do you understand? If you have the disease, we enroll you, we'll follow you up and all of that. So these are some of the things I will say. And I will basonia you do two address you say obefe draw obey by review say you have to be punctual, you have to be compliant. I say obefe draw no oba na yes ka say be a folic acid and I say now I'm far the we have some patients obeba 2 years no eja tum however, a new problem. But if we are following you up, you to me pick some of these things, and then the process can even be reversed if possible. So when the American say one, I was out here as I was sickle cell now now. I was out here as I say you can live a very normal life. Our eldest patients is in their 90s. We have people who are above 50. Every Tuesday we see them. Okay, so a very normal life is possible. Who are working at big places, so it is very possible. Say, able to live a normal life with sickle cell.
Odofweni yatini Dr. Kanomeni me de wo hon se osi ubetumi abowo bra to se senior obi biara ebone bra nemo ehu hia se obeye city ene odi oyo enso ebeka ho esan se wutumi ba clinic se ebia oba wo de na komofra clinic bia ho anase Tuesdays bia wo kokolebu na ye hwe wo ho no ma ye kire se ebia bra sa date ya menka se mabre entimi nkobio so ta eko eno keke no ne betumi aboa na afi nso eye me de se doctor o kan se ebi mu wo ho beka se oh yare we de anya no kre wo de yesara na yenya yenim se nyame asem na e kan se esan nim dia me man enim nti no omo hwere omo nkwa anase lack of knowledge my people perish and what se eba ne sa se ebia yehu ne ntema bomodin se yebetu anamon na e wo se yetu no na etumi aboa ye bebre doctor we de many aje se o dom ye eni nimdia ente se na se sia se ye hwa empempe no ebi wo ho a ahyase no kwa kan se ebi wo ho a ye nyafi awufuo mu enti ena ne eja emu ena wo san kan about pain or yawo no sa yawo no se ba ombesiden anase besiden na ya handle no se me ye awofo anaso bi ye awofo a wetumi we hu say okay me ba no ni ofemu nie beside aboa no ana me ho kafo beside aboa no ana me ankasa beside aboa me ho.
Okay, so crisis there are different types of them. Okay. We have to make that clear, and so we expect say one who sickle cell disease now himself was arena. The moment I will experience any form of pain, we expect that you come to the hospital. Not just a number of hospitals. Hospital be anywhere sickle cell. Because crisis here can a number of things it to me trigger. One of them here extremes of temperature and I will be brave and I should be brave. It to me triggers our crisis. And to say when him say Oba was sickle cell, now it's your time and whom he has because I wouldn't be bra or to me it to me precipitate and it to me trigger crisis here came. Another thing no sooner say all forms of infection or more sickle cell disease can trigger the crisis. Okay, so that is why the first thing I also hear say also obano and I say nipano or pain crisis oko hospital. Oba hospital one of the things we do is that you be manage pain no, you be more painkillers, you be more yaw no, aba form and be more bearable. We also do certain tests to investigate. Ni a damn important and a mass crisis here by almost all the crisis episodes they have triggers, so we'll ask you questions, you better examine or you better tests and ask us to pick up what has caused it. Now you treat it because no painkiller. What happens is that nambi pain no de I say you cry about the plaster to so keke two asie no asie kro ade causes our pain no solve it. What we usually expect is obeba hospital and we'll take it from there. Now some of the people are more sickle cell with time no they get experience to know how serious it is. Okay, sometimes your patients know we give them some painkillers to have on them. So minor pain episodes but they can manage initially at home with some first aid. Painkiller and then we'll take it from there. But the moment pain will be do a certain threshold, we always ask you to come in. So the long and short, and I said, may say I did to your trim, and then they say, if you're having any form of pain episode, please visit the nearest hospital. So to me, I would always refer you to the next step till you get to the bigger center where everything can be sorted. Yes. So don't keep your pain. I always tell people say pain is painful. Now, always go to the nearest hospital and then it will be taken from there.
Inti adofo ene enkomodie ayedi hunkomo yesi etutu sickle cell disease eno na ye hwe ne sesia no ena doctor amaye ehu se yes omoko ahoyahie mu omoko yawo mu na yita yawo no yenyina enimu se yawo ya eno nti sesia ne me pese ye hwe bio ne se doctor ebi wo ho a na oba na se onyem nas anase opese onyinsen na nase obanyim echi nase okowo ye meside wu se bia na minyinse yi me ba no ebewo etutuo yare ni bi anase se mekora me wo etutuo yare na emra menyim yi den na metumi aye.
Okay. Enti de kan ebi anka nkomo bi anka ese di ene se sa yare a ena ene eja edema eba
enna ne eja
edema eba nti ene yare a unibi all of a sudden no enibi it's an inherited disease,
right?
So say oba nyama yen tackle the pregnancy aspect. Every single person that has sickle cell disease no or pregnancy no, you categorize as high risk pregnancy. By that no, what we mean is that unko antenatal biya to so biya sad, because we have specialized or trained people to specifically manage or pregnancy. And in fact, we actually encourage people say sickle cell and also to 2 years now person even start seeing a gynecologist and I say or care provider and some when you send cry because na o etutu yare na o pese wonyinsa na wonu kunumu yare bi and amo ye sebe careers na pese munyinsa ya you have to see your doctor, okay, to have discussions, because that pregnancy is a high risk pregnancy that can be sebe characterized by miscarriages and I say premature birth, and I say obanukra to mean low birth weight into pregnancy no and I was here planning but that's where in the side of the world no lack side no ninsen neighbor we are any 2 but no problem. So ninsen na ba we always advise say you have to be seen by a doctor, okay, and when you are being seen by a doctor most of the time you better refer wako baby a ubenya care na unhia ni nyina throughout ninsen no into say antenatal for 4 weeks yenja wo satra e woni nsen eni ediwechi every single step of the way, because uninsen is special and we have to make sure say miscarriage and as a premature birth and as a low birth weight intensive biambim nti your banner or sickle cell you have to plan in 𝗪𝗪𝗪. We have the sickle cell antenatal clinics. Your days doctors ekukudam nurses specialized ones lab scientists eba omobehwe omo sa yare sickle cell omonyemi. Yes, so adult sickle cell clinic in 𝗪𝗪𝗪 no so bana unyenyi nsempe we always refer you to the specialized people. Some of your bosses also so was our experience, so they go to the antenatal clinic on specific days to run the clinics. So when the moment sickle cell now we always encourage that go to the hospital, let them know say sickle cell, and then it will be taken from there so that you be to monitor all throughout pregnancy and at delivery, because the delivery process can be quite complicated. So we have to make sure that you need the witchy every single step of the way.
With the no normal would a wake up call. Dr. Kwabena Amwako and Yenini AD and Komo Hase or doctor or clinical genetics or 𝗪𝗪𝗪𝗪 Teaching Hospital. Share it to sickle cell disease and in ye bit to me a year a boy year na near all cassia effort ninsen who say abia when you must think a beya mention any mansa na assassin na you who a doctor for na I am the cell say a more specialized and as a special clinic and the ma wonga when you so that when you become kosise omobewo at least eno kra hope enti misrara say bia wonyima menka se wo call ada small clinics bomodiana bra me sure say wo come ho say doctor
start small clinics na they are channels and protocols in place to make sure that even if be bank kolebua and men case faka na bra kolebu straight, but there are protocols in place. The moment do man polyclinic and crasi baby cry, the moment you be sickle cell disease, no, there are processes in place to make sure that you get the best of care, and I will say you move to the next step, it will be done.
Now, Dr. Ebiomononso, no, when it comes to I shall say no can say baby about prevention, any treatments ade treatments you bet me asan kra maybe and I say idea for life just say be manage na and can it be prevented? If yes, you be that prevented.
All right, so sickle cell disease in English is a chronic disease, but that's a lifelong affable. However, there is a cure.
Oh, okay.
Yes, there's a cure. The unfortunate thing they say, and the NSM say it is not very available in this part of the world primarily because so sickle cell disease can be cured in a procedure a friend say be bone marrow transplant and a stem cell transplant. Okay. Problem no, any problem they say red blood cells now body need producing no. There's an abnormal hemoglobin, a friend hemoglobin S no. Okay. Inti factory now it produces our cell no. Problem no ho. I say ye tra coins and ye tra blocks. So block mode no problem mo ho. E be produce default and faulted blocks, cement blocks. Sure. So the cure they say will change factory now produces cell. Now it comes by say one, you need to get a donor match. Obia ne bibia ete say wo aye de ono ne stem cell anasa ne bone marrow emawa ebe match ebe ye typically no siblings and as parents. Okay. Not all the time though. And then the other things about say logistics no it's very expensive and it's not very much available in Ghana, Africa. So you'd have to travel outside hundreds of thousands of dollars to be able to have it. So in as much as a cure no, it's not very available. Although we've worked up some of your patients that they've gone outside to have such procedures, but in this part, yes, it's not very much available. Okay. And that would take me to other supportive treatments, and then we'll discuss preventive measures. Okay. So supportive therapies, I want to say, in as much as say you need absolute cure in this apartment. There are some drugs if any disease modifying drugs, a tricky body, in a way to produce a tricky body na man produce sickle cells na cells na SC na a tricky body to produce more of the round cell. But couldn't very common in these apartment hydroxyurea. Sa in a bimu friend the miracle drug because
Dr. Sana can't because I can't miracle drug. Miracle there's only so be a miracle. It's here for an for the person and the mamu ehune say ye didn't come more efa 82 who yare and as a sickle cell disease. Yeah, pese muhu say near addition dia ye channel and net ye say mwa bebre wo ho no mo say ebia wonyem kwa beko hospital entem anase memfa wo ya wo ne entne fie bo modern say obeko amaya show na ebia sa complications aye kai bebre fiuti ase kopem onase no say ebia we hu bibi sa me pacho men ka say me de me twen ko say no ankasa beko ana ya ma wo date cross bra clinic na bomodian na kone nru na de be ma no so be hwe so anom no na emriti awa mu no ye pese ye ko break briefly na say ye ba ye beto aso ene ye miracle drug no say na Dr. Abuakon kana sa no say ye wo emwa edema obi biara a owo sickle cell disease enunti ye domase mamonko etwe so wo asebisa anase bibika wo de hwe set numbers ni gu ase na enche ebibi telephone na so be what will be sawa 7 no ye domase bebre enti muntanse na montwen. We'll be right back. It's
It's that time of the year again when the Methodist Education Unit allows all Methodist schools to experience Methodism. It's the launch of the Methodist Education Week 2024 on the theme Discipleship, Growing into Christian Maturity. Activities lined up for the celebration is as follows. Tuesday, the 7th of May 2024 is the Connectional launch happening at the Wesley Towers Auditorium at exactly 10 a.m. Wednesday, 8th May 2024 is the launch and talk on the theme In All the Regions and photo exhibition. Thursday, 9th of May 2024 is competition on drama, preaching, singing, and reading. Friday, 10th May 2024, time with PTA, SMC, increasing parental support in education and combating truancy. Saturday, 11th May 2024, cleanup exercise. Sunday, 12th May 2024, Thanksgiving and fundraising in all societies in aid of renovation of our schools. Speaker is the presiding bishop, Most Reverend Dr. Paul Kwapena-Boafo. Chairman, the Director Tertiary Education, Bishop-elect Accra Diocese, Very Reverend Dr. Ningmai Olenu. Special guest of honor, Deputy Director General Management Services, Mr. Stephen Kweku Owusu. It's the Methodist Education Week Celebration 2024. Nyansa ashese onyinamishu. Let the little children come to me and do not hinder them. Matthew chapter 19 verse 14. Oh yes, let the little children join hands with WTV every Sunday for a special children's service with the Methodist Church Ghana at 10 a.m. with a repeat at 2 p.m. on WTV and Facebook. Nyasa ashese onyinamisho. Wesleyan Television, reaching out to the world.
For way dear Yasama Mwakwabe Biom Ewo Emra Mugusara Mutie Etisumu Ensemwoye Apomudeho sickle cell disease na ene nyame adom yembebre yene Dr. Kwabena Opoamwako of the Ghana Institute of Clinical Genetics enti omo no mo sickle cell mo apomudeho na oniye atwetwe enkomo bebre yegusara eko na ansana ye commercial break na ye brother na say doctor can say enro e wo ho cry to me de boa no e bi cry dey say was miracle oh okay miracle then no na me do
no so that is
it and I say the same drug.
So it is the same drug.
Right.
What it does is that a modify red blood cell producing factory, now it producing more of the rounded type of cells, in simply put. Okay, now this hydroxyurea, initially, it was a drug used for cancer patients, but a lot of studies were carried out in the who say a boapa or more sickle cell. In fact, some studies but right here at the Ghana Institute of Clinical Genetics, we do a number of clinical trials, and we found out that very helpful. In fact, our patients speak wonderfully about the drug, so it's quite helpful for more frequent and severe pain crisis, and even helps reduce some of the complications now. Now there are other supportive drugs like folic acid, Zencovit. What those ones are there to do, they say, it's say our body it produces defective red blood cells, and ideally every 120 days and 3 months, 4 months, sorry, your body breaks down your red blood cells. But more and more sickle cell, what happens is that every 30 to 45 days, it break it down. The thing be now moja or form. So those drugs, folic acid, zinc, it helps your body to produce more young red blood cells to take up the role of carrying oxygen around the body. And there are other medications like painkillers, paracetamol, tramadol, and some other painkillers that are there to help manage these pain crises and all of that if they come up. So these are some of the things I hear for people who have sickle cell disease. There are other indroa eba upper studies are being done outside and here, right here in Ghana, especially at the Ghana Institute of Clinical Genetics, to find more ways to improve the quality of life.
Okay, right. Inti we de say ye kosoara no me pese me fa akwenya yeso eda asafo mame ayeboafo as the wife of very reverend Samuel Bwedu ayeboafo owo Kumase se otumi eboa ye ema yetumi nya etutuo no sickle cell disease. Enti mama na mi ensha bibre. Enti Dr. Sabri ansana ye betwa so ebisa ye wo questions kakra ya hwefo no edeba na mo mpesa wo hyase ema yehu se would be couple na se wa oba be ware wo kan se ye ena eja na aba eba ho enti wonga afi no be ware no ye beside hu se ebia na me ne mene no eba be ware yi ewo bi ana miside se ne be ya ye mofra no enkonye bi.
Okay, so there were different types of hemoglobin. I make me. There were hemoglobin A, there were hemoglobin S, there was C, there were F. Okay, there were other subtypes, beta thalassemia. The first step for every would-be couple, and they say, "Mobedi can I get tests to know what your genotypes are." Momo genotype, na no dey. They say we AA, we SS, and advice say. You do this and son now relationship no ayeden akonenim because it's saying pempi wo ho no say relationship no any courtship ne konenim na yenya hu say sa problems kakra ho na amana ayeden kakra but the first step ne say you always know who nipa no do hu genotype and your partner ne genotype no now if any of you have or if both of you have at least an S hemoglobin then at least the chance of each of your child having sickle cell disease here at least 25% for every single one of them. Okay. The mistake and I say erroneous misconception nipa bebre one say omodwen say say me wo for abako AS na say wo for abako pe na ebenya but enyesa every single pregnancy carries an independent risk of having sa yare. Nti modi kan check mo genotypes. I always advise go to the hospital, ask to speak to a doctor or a genetic counselor. A genetic counselor. They offer some of these counseling services. Do you understand? But specifically talk to the doctor and say that, hey, my fiancé is this, may away, so that you know what the chances are for your children, because you have a decision to make. Because if you give birth and either of your children was a sickle cell here, like I mentioned, the impact is not just on the child. Okay, it is on all parents. No, a lot of parents feel guilty sometimes that they have brought into the world a bar or sickle cell. But in your baby, until say but before it can happen, I always say go and do the test. Okay, you can walk into any clinic, any hospital, or more available facilities. They'll do the genotype test for you, and then you see, and then you take the next steps. So my advice to every would-be couple is know your genotype, know your partner's genotype, and then speak to a doctor or a genetic counselor.
Se afi na mo ba beshisha wari know your genotype, know your partner's genotype as well. And nasa obetime ne a doctor nasa counsel bi akasa. Na doctor we na obi asene message pese me kan kakra. Mr. If our viewers could please add your names and where you are calling or sending the messages from. Bako say, hello doctor, please, I am a lady of 28 years old with genotype SC. I have gone through a lot of crisis growing up. I'm a bit anxious about giving birth. as I am getting closer to getting married, any advice concerning having normal childbirth as a sickle cell patient?
Okay.
Although the issue has to do with the delivery, basically they're not with normal childbirth. Right. And second one, when the home come to me fair and come up. I say, please, I am watching you live from OT region. Yeah, that's baby. Please, I want to know if you have a sickle cell disease, who should you marry? So your children, and then with the doctor, I can't say about it. Because I'll fire messages name na yen fire D any baby I can if
okay, the first question.
Sure.
All right, so thank you very much for your question. You are 27 if 28, I had 28 and SC. So my first statement or question will be, are you an attendant of a sickle cell clinic anywhere? Okay, if you are not, you need to register at a sickle cell clinic in any of the facilities.
No problem.
Also a 20 or 28 years or SC genotype. Just or sickle cell disease. Okay, into na me can say maybe son say or one kasa or clinic and a sickle cell clinic be a share from time to time. Say on yes sir also to sa na mo. Also me just so can I say me the NHS say our partner and I will be a person worry. The next thing they say I will say you on only partner no the genotype. Okay. And then the other steps will be say once they get married, they should see a gynecologist. Okay. To talk about their conception, pregnancy, and everything. No omonia then into me good advice on that and then possible pregnancy. But once you get married, you're speaking to the doctor. I'm sure they will take the very next steps. It's very important. Register or sickle cell clinic. Make sure you know your partner's genotype. If your partner has either AS, SS, SC, then the chances of say sickle cell disease are very high. Okay, so we have to be careful about that. So once you check your partner's genotype, speak to a doctor, speak to a genetic counselor, okay, and then we'll take it from there. If you're anywhere in Accra, I must add, we'll be to me about Kolebu, Kasaupa Sickle Cell Clinic. I'm sure you'll meet me and we'll have a good time.
About with the doctor sister and dear Modiana Bra Kolebu, na senior or patria will say, or per senior Tibiano, yes, we share Ukuna be warren and so dear, na a face so mobile
doctor, doctor, so that planning pregnancy right from the very beginning. Now, she should just be rest assured say once with the right preparations, a very safe pregnancy and delivery is very much possible.
Yeah, that's it. And then see, Bema Francis, if he atonsu was sending a voice note, if briefly.
Good afternoon, dog. And I was in the program where you perceive as I say. Everyone will say, or a career na a normal na so a secular AS and SR normal. You perceive business do I now hospital or person check him out. But hospital will be brain especially government hospital, could be I say a higher check you it's all come machine. You say machine the checking the bin. I think say what to me Buana must send the message across I bet Buama do na bet me check him on say you a career must or career who will be signing normal. Now the time no so private hospital because say then as a government hospitals are hold on I am only some machines to be the check is hard in my
that's a baby.
All right, Francis, that's a baby asemi. Into the specific tests for sickle cell disease, one of them is the HB electrophoresis. They are specialized tests. And your hospital be any bit to me running, especially the very lower ones, chip compound health centers. Not very likely so maybe to me are running our tests. Until we the facha ya kakra, but so per hospital kesia be to me running, and any laboratory. These days you will have quite a number of laboratories around. Be to me running these tests for you. And into an okay say career. What this time career we are by the next year trust ya kakra. Your case will be a sickle cell career or you will be a over 1S into be a AS is a career.
Will be over 1S. Because you can say it will say uniano at least an S.
At least an S. Wow. However, the caveat is that will be AS no the person does not have sickle cell.
Okay.
But ono to me the S no e maneba. Into sa AS no okoware another AS. Okay, there's a 25% chance with every new say omubenya no say because AS no awomu no obia was a HBs no 2 into AS ni mienu bema AS mienu oba. Okay, say obema hu nsuo no oba hu nkosua Asia baako beko into either say bema ndi A beba no oba no so di A aba ana bema ndi A beba no oba ndi S aba ana obema ndi S beba no oba ndi A aba ana obema ndi S beba no oba no so di S aba. So there's a 25% chance with each pregnancy say obe nya akwala or sickle cell and a 50% chance say obabia ebe career. So that is where those things are. You're very careful. Now you play along.
You're very careful. Not our kind of sad. Maybe your phone line no to Jana and no children not maybe besides say so you make us say S no S back one mama nko obia or S bia ho ada you remember this. So whilst you're waiting so doctor to answer ye pese ye tie mo e bia or pese ubisa asem ana wo ka bibia and then na your telephone lines no e bia amamo 025 2625 3461 025 625 3461 and into be to me a friend not we be sa wasem and I say no pese oka enti ye mi aba comfort efi gomwa takwa pato ye tiewo
medase
aba comfort gomwa to say
nyame adumboko
ye de radio say so afre ye tiewo
mpacho na pese bisa doc say Meti se ogbo folic acid e wo ni duro no.
Okay.
Na advisable say wo nye because patient ka obetumi afa bibia na.
Okay. Enti oba comfort ya da si bebre enti yeah comfort bisa say so wo nye sickle cell patients cry obetumi afa folic acid ana.
Okay. So senior mekan no man ka say omofa ne sa akwa na emom essence say tembia they have some reduce and I say moja level from those are medications that help and I body ni money producing more blood. So we sickle cell Arabia na say ehuntutu yare bi na say moja e fine udidi ya ehun hia say obefa folic acid de bia ehun hia at all as long as say udidi your blood level is fine. You are not having any problem BIHS or moja so our form no. There be more sickle cell and the other main use a mom and and I will typically give them folic acid supplements. And sickle cell mainly. Right. If you don't have.
That's why you were another caller, Adelaide, Efrefi and Coco. Oba Adelaide.
Pacho, my question is say.
Okay, Pacho, you too.
That's my possible say. Obi what genotype SC. Now, so on show signs of sickle cell
Right.
Okay, Oba Adelaide, that's Sibebre, set in Coco AFI. Okay.
All right, so Adelaide,
Adelaide, Pesame Irene, and also Efrefi. Okay, Pacho, we have lost Irene on the line.
All right, so Adelaide, you mentioned say Obi SC your own show, yes. Emre na ama ye kwame ntumi anko niema mu bebre kakra, but sickle cell no, yes, one of the variants SS. Ye omo so omo SC, ye SF, send them can SD, SB tata, omo nyina wo ho. Now the two major ones SS and SC no, omo na ye omo tie dose pa. Na SS4 no e more severe disease and omo show more severe problems. So yes, Adelaide, we are correct. We can say Obi or SC. Now say on show most of the time, no, a lot of the SCs for no or munta and problems to say SS. No. We can have SS for so they don't show some of the problems, but SCs no generally or more less severe disease or more than no nya dimpa to say SC4 no.
SC4
no the anonya there to say SS4 no. So yes, a number of people they come regularly, but omonta bone pain other problems. But there are some complications a higher SC4 no than SS4 no. So those ones are there. Dynamics no. But when you come into the hospital, we'll let you know so that SS how to do your things. SC will let you know what are some of the things to look out for. All those things are there. So Adelaide, yes, you are right. Obi or SC are on-show problems.
Adelaide, yeah, that's it. And yes, you know, Dominic from Western North. You know, Dominic. Uncle Dominic, Mpacho, Apo to say. Okay. Yes, you.
Yes, I want to contribute. I think even as couples, when they give birth after 1 year of birth, it will be advisable for parents to send their kids to test. I work at the hospital, and most students that come to see us and don't know their test or they fall sick, always try to send to the hospital. They only get to know when they are in secondary school. But ideally, parents who know their kids, their genetic genotype status, including good secondary school, so that it will help teachers who are managing these kids in secondary school. Because if you don't know, when they go to secondary school, they send this sort of crisis, and because they're better for teachers and even healthcare workers. So it's good for parents to know the status of their children. Right in 1 year at home, you can walk to any hospital, this hospital, so that you can begin to give advice. Right when you say you shouldn't wait for the child to become an adult so you don't use this kind of genetic condition. So that's my contribution. Thank you.
With dear Miss Uncle Dominic, yeah, that's it, for your contribution. Yeah,
yeah, okay. Dominic, offer me region.
Okay, what's it?
All right, yes. Dominic, thank you very much. So ideally, in the developed world, like the US, the UK, they have mandatory newborn screening programs. In screening. In Ghana too, yes, we've rolled out their rollout of such newborn screening programs. But in 10 years, as a result of say resources, need for us to do it widespread. But in some of the very big hospitals, there are newborn screening. Say, they screen to make sure that there's no sickle cell, and if they have, then they let you know. So yes, like Dominic advised, say, we are mommy and papa now will not say. And test for sickle cell. You can walk in and have the child test, especially after age 6 months. So that time, na fetal hemoglobin na clear. So after 6 months, you can walk in with the baby and say to me walking in your screening. Thank you.
Pato, Dr. Minfa Nana and so from Central Region, Nana Pato Ekose, Central Region. Hello.
Pacho, yeah.
Nana, Central Region for whom to say.
Pacho Boko.
Yeah, that's so afraid. Yeti was but I say we be seminar.
Pacho, me be sase. Me wa down for you. Now I say, and they are not catching me so some disease because people be a bit.
Okay.
Or say like functioning that of my chain, we are done functioning that so far away. But some of the young son says of the country, but some of the doctor say, like if you are, it's me, and I join to me that
okay. It's Dr. Asana, answer, and Nana Yandasi be brave, so would you want down for the home. We perceive me the Irene's Tapra de Ekaho, na afi answer. Hello, Auntie Irene. Hello, Auntie Irene.
Hello, Madam. Good evening.
Good evening, Irene. Talk about the phone to say you. Yeah, that's it. It's in part of your tea. Yeah, part of okay. Okay. Okay.
And I'm going to challenges. I am before that for many I said every man the person who near that it is not about a good thing I will zero the ending. We don't have a pattern at the hospital, normal farming to a bit normal money to a baby. Now, the patient said, without test, and when said the make me any at all, and I said, might happen.
Okay. Enti oba Irene ye dasi bebre Dr. Beyi wonsem na no ama.
Right. So yes, that's it. Yeah, for Irene there, yeah. Start it. So yes, Irene, it's very possible say where SF wa wo mba miensa omoni bi. So it depends ejina o partner na bema na one ne wo ye no. Ono ne genotype. Aha, there may be an speculation, so we won't go into that. But yes, you may, and I say, maybe I said run a boy, but and to say para or drugstore no akoto there be. I was say oba na test. We first have to confirm cross SF no. We be a tembia oba we do there's a higher test I friend HPLC to determine hemoglobin percentages per to the down to the T. Am I into oba test any renaissance oba that's watching into no was here check your kidney or liver you check your junso mo bibia make sure say nipeduano bibia okay bit ma handle sa edro and sana doctor atro amount nti Irene the mesusu ne say obeba call a book sickle cell clinic and then you show we are be tests me and Sambi to make sure say BBI okay safe and I say drone cry a bebo a drone ya demo omonko a benefit you nti no be din komo you be making sure say BBI okay na drone and when yampo say ya do beto so ana ansana will take the steps nti enye draw obetumi akoto nesa e wo sa oba na ene udin komo ansana
right. Doctor da say Edema Irene ebeba na de ne so but yesan akota kra de bio Susanna ewo honom na we bisa na sem mansu yes me patcho se wo ho ye yeti
me tene folic acid
okay folic acid no
aha we should patient out menumana
folic acid okay does a patch out say so okay yeah that's patch me fa we so enka ho and also for 𝗟𝗓𝗪𝗓 atakra ebisa say which genotype gives birth to AC say ebia de wo he and yebetimi de awo obi a owo AC patch
so yeah Madam Nediana start Auntie Susie. So Auntie Susie, who stroke wasem no sebe different kakra chain and then common na ye bono. I will say okona ye check it. In fact, the type of stroke I want all those things. But folic acid in ye draw will be a stroke. You do better routinely, unless maybe a problem be or why a person have folic acid no. Solve my. But I just said there only folic acid in yasem kakra. Na also for atakra bisa say genotype then you do AC nti ni nyina combinations but AC is say wenya A if ni papa na ne mame ho na wenya C if ni papa na ne mame ho nti possibilities no ebia ne mame and ne papa both of them can be AC and o mama AC no one can be SC one can be AA and o mama AC no what can be AS, what can be AC, and I'm an AC, no. So combinations need different, but what it means, they say, we na A fiber alcohol, and we na C fiber alcohol.
Wow, we na A fiber alcohol, we na C fiber alcohol. Yes. Papa, Pesa, Madam Patricia, Effie, Tema Newtown, Auntie Patricia.
Hello.
Yes, Mama Pat. Pacho.
Yeah. Hello.
Pacho yeti Auntie Pat.
Pacho, maybe say folic acid ni biko ni multivitamin no. No baba ko no so SS ni bisa ba ni classes na ntamba.
Okay.
Ti bisa say compose you say they be obefa sa 3 medicines na.
Okay. Oba Patricia yeda sibibre ni wasembisa.
Okay. All right. So Patricia, thank you. Me jide say ebia oko clinic and modern natural folic acid ne multivitamin B kono. Inti senior doctor ne ka so be fan no patro fan sa maye. Why although the crisis number no ultimately no fan to so debia see on fan debia and patcho ye sa emaye ye na ye danyame aso say the crisis no emba be brain ye ntwa edro ne so another mistake ebi mu ye ne say omunya crisis a and omo kai say omo folic acid ne zinc covid wo there be uba ye say one daily the tablet I see there so ye trust na obefa no nti fan say ne oba hospital na clinic ye ka say fan na
nti oba we dey say mentwe ma crisis number and ye there radiation so say oba no onya crisis nti ye nkoswara nti ye wo kanda wo water region ye tie wo ye nia. Hello, Yunia Kanda of Faith Water Region.
Yeah, hello. Yeah, good evening.
Good evening. You have your water for who to say?
Okay, please, I want to find out, is it only those with the S who are supposed to visit the clinic, or anybody who has F, any other genotype can go to the clinic?
Can you come again, please?
Please, I want to find out if it is only those with the S that can attend the clinic.
Which clinic are you referring to, please?
I mean the sickle cell clinic.
So you need to have sickle cell disease, and so either you have SS, SC, SF, S beta thalassemia, SD, SORAP, all those ones. So if you have just an S, or if you are AS, for instance, you don't need to visit the sickle cell clinic because you don't have sickle cell disease. If you are AC, for instance, you don't have sickle cell disease. If you are CC, you don't have sickle cell disease, so you don't need to come in. It is those who have SS, SC, SF, S beta thalassemia, SD, SO, all and on and on.
No, what's the sickle cell clinic? Yeah, that's it. Right. Eti emra ye guswara no na ye kase ye phone lines no ye be 025 625 3461 025 625 3461. Ti emra ye twen questions and no contributions no na Dr. Oka about couple and son na obeware no na me pacho ma memfa.
Okay.
Hello.
Hello.
Yes, Mama. Mpacho WTV consulting room ni. Mpacho. Hello, Mama Mpacho tienka.
Hello.
Hello, Mpacho tienka.
Hello.
Mama Mpacho your friends.
Me Mpacho me friends beaucoup ai.
Me Mpacho you. Mpacho Mama Gladys ni. Mama Gladys Mpacho yetiu. Se wo hoye.
Mpacho says na doctor can SS for asam no.
Okay.
Na CC no
Okay. Yeah, that's it. That's
Okay.
So was CC.
Okay.
So strictly put, no CC and sickle cell disease because in the definition, there must be at least an S.
Yeah.
So CC strictly and sickle cell disease. However, at the Ghana Institute of Clinical Genetics, there are CC phobia or mobile reviews from time to time. Yeah, they are more but they are not coming because they have sickle cell. So nipani is CC only sickle cell area no. Nti enya dia ohia so be sickle cell clinic. Na emum oho na ye wo CCs bia they come for but omumba as regularly it's 3 months na ye pese other ones ne ban they come maybe was 6 months and 1 year just to see how they are doing. But CC dia mama oba no only sickle cell area ni bi. Why me that say.
Nti mama sana doctor can say oba no only sickle cell area ni bi even though abimu etumi eba clinic no. Great. Enti yasa ako Western North bio yenu aba Georgina won Western North. Yes oba.
Madam Obi Bawe essence.
Okay.
There's a hospital ma near man of foreign acid ne shikro. Na zen kofa. That on time fanen kona e woman na drink na yo to bi mano advisable and I said adrenaline also for hospital.
Okay. Yeah, that's baby Obagina. Enti Dr. Nani Magina Ebisa. Say so I was said the be mobile hospital na and that's what me ato do na to so
hospital calling a problem no. Okay, that's fine. So Jenna wadam for neba no. So usually mobile hospital the obia a case by case, okay? Until you show ni evaluate ni ehun say bibia okay ah. Your ma review dates.
Great.
Until obi wo high expect be hu be every month. Obi so wo high case 3 months, 4 months, 6 months. Okay, until ejina review dates na yamano no. The ehia ne say review dates na amano no. Eso a obekọ. Na say date na nso na say problem or why you can go in. Me te say all can cipro bi ho asem. Cipro enye edura routinely ye de ma ebi as that time na okoye no. Onya infection bi and ye de cipro no a treaty. That's the another mistake I try to see because people will come to the hospital otro edro ye man or jinse edro we na tem bia e wo so offer there be entisa edro bi wo ha ye de ka ho based on that particular time ni nyina doctor ne be echrecho. Another thing I made the cancel is mobile hospital am bisa question the patients mbo ebu am ya na bisa nti woni hwe ya obebisa onipa no be jinse wate ase bo be kofie no no wa ye confused nti e so ma wo ho kwan say wo bisa question bia wo pese wo bisa so ko hospital nti wadam for no onko hospital no mbisa o mo say how often no mo pese oba impensen another ben bio no pese oba na edro we de he na eso fa de bia de he na esa obetimi ato until send the review dates because we will man a 3 month review but ebia ni sika so 1 month into what 1 month there in that instance your amount prescription ebia say esa wo to me de to so all those things are there onko hu the doctor na care provider no hu ye no on be che ne de obeye
doctor I will be or free Cape Coast. Hello Uncle Dan.
Yeah, hello.
Yes Uncle Dan. Yeah, that's a say wa free impacho yetie Cape Coast for what to say. Yeah, there are this impact yet you.
Yeah, Miss Margaret, stroke, when you stroke out of the focus. If I don't know, I don't know about something. I think that, but only we are stroke.
Okay.
She has recovered, although, but also still Togo, Nano Shokaka. My first question is, like, will it be healed completely? And answer then. Secondly, with the hydroxyurea, she's on the hydroxyurea. Now, the person who said, is there any side effect of taking the hydroxyurea? Because I was told that a woman. It may affect is it the kidney or the liver. Most of the times, we are called or this test.
Hello. Okay.
Yeah, hello. And I want to know the side effects of the hydroxyurea.
Okay.
The first one is
okay. Uncle Dan, yeah, that's into Dr. Bemao Anuji, Nansana, Yebekeno, no, Yepese, ye call Takra de na ye ne Petra, and so Ekasa. Mamma Pacho ye tio.
Mebacho, Nepese me busa doctor said, me bano, oye AS, but now, or find some, yes, some deficiency be like JCSPD, into yedenato, folic acid, so.
Okay.
And a zinc. So, but onya viral infection we are na pneumonia samna ko form.
Right.
It's doctor so church like I am arguing akaka say bia SS na bia result no na on say me hu say me chem on say as a result na bit me afreli ana me hu say make no because waji moja mienu ASO. Marian says GCSPD, your mommy guidelines are in the okay. This batch of me near the Miato, I say women of folic acid and zinc feed. The person doctor know like or like to make a cry or hook. I mean, saying yes out of it, but the person me because like before a young before now the first AS na
Ojimoja crisis.
Okay.
Yeah, that's it.
Thank you. So yeah, starting with Petra.
Petra.
The one, yes, AS1. My name health facility and our hospital crowd call to me cast results near right and wrong, but I concede that there are times where some of the results might be interpretation or no problems kakra wo ho. And I mean the currently a doctor say nipa or share no I didn't folic acid 𝗟𝗓𝗩𝗘. But G6PD deficiency area yenina ye hormone anase ye obibi ewe emoja mu eboa nipadua no wo ni nkita hode ebi mu kakra na ebi mu wo ho mu ni sa G6 ni bi enzyme no glucose 6 phosphatase no nti eno sa ne from so mo G6PD deficiency. Okay, na phosphate dehydrogenase, sorry. Nti eba ne sa na de niema bi ebi wa things like a draw a containing sulfur based drug sulfur and say some camphor, some type of beans. If they eat those things, it to me cause problems more. Intina ya mouse a list of near man and diania was a would any no. So that's that. But say ni moja air short, you know. Sometimes if you get some problems with G6PD, it can cause some hemolysis. Everyone emoja buffer. But OPA we can repeat or you can get a second test done on the genotype to confirm say truly or ASR. And test na yedi hu say obi was sickle cell your levels. Okay. So the first one is the HB electrophoresis. No, and first one cry a sickling test. And no be won say S or what. And then there's the HB electrophoresis and then there's the HPLC send and Americano. So we can recheck and then possibly do a higher one to really confirm so ban or AS and I say but other than that no me sure say the nipa no this andro man ni madicruntia or yes so you can go back no mon church or say so a second opinion on the genotype na yenya another test to determine. And then the first caller no say ne ubani stroke. Okay, so like I said, stroke is a complication of sickle cell disease. No, the moment of being stroke, no, now the person has had a stroke. The chances of getting another stroke is high. Okay, until you have to attend a clinic. I bet in this assuming say by clinic where now we stroke. Yeah, sickle cell. Doctors are mostly muja some yeah, working hand in hand with other specialists. Into we stroke. Yeah, the neurologists. Ebebim. Stroke specialist or mobile ebi a physio. So when you get stroke, the post-stroke care no, I will say a coso. Into say ubana toguso. Into toguso I have to ask or ye physio now because the stroke ne bana or lose ne body parts be known to me fanya. I also undergo some physio to help see ebe regain ya. Into any natural say ebe basa no ho beto no complete sa nti onya sa post stroke na
no kakra yemfa kofi or frefi kokomlimi ne de no aka ho ono be ye last caller yenim say nkofo be pese efre na emo nyame yadowa na oche ye betsoa so any jumedi fefo nti bra kofi.
Hello madam
Uncle Kofi mpacho ese say pacho yetio Kofi Antini ye.
But you the doctor said, "Me partner."
Okay.
Now you will still blood group. O positive. I mean genotype me.
Genotype
me. An anti.
Genotype me.
Okay, anti genotype.
Mommy enu nyina AA.
That's
why. Ho.
Okay.
Pacho, you where they say I'm on license. No. Pacho, Uncle James, your callers ne ba kon hoka 4% okasa kakra. Uncle James and Pacho yetio.
Yeah, man, that was fine.
Amen. Yeah, that's so our friend so.
I'm
okay.
Me say me that e ba ta look at the more and to
Get me then.
I will be do me more
okay.
So the
Okay. Okay. Enti uncle yeah that sibebre set will be sent you no be say to me there be draw to if it's a sickle cell disease I say and na obi nso bi say e no kre say one or what tissue S no omunya AS no omunya malaria na.
Okay.
Yeah, that's it.
So AS no say no.
Yeah. Final word
right. So yes, studies who say more AS no they have some form of protection against malaria. Women into mean come into details, but yes, there's something like that. And then about say or say ABB draw.
No ABB draw.
Right. So the problem with Ebibidrone say we don't really know the exact constituents a woman and then at least I over hospital na me ma folic acid and my supplement meaning say we na womb nti say me instance so be ba meaning say dia we na cause and we na cause but with Ebibidrone there's nothing like that. So yeah, I generally advise, or it's advisable, say you avoid herbal medications. And I mean, patients, so by I tell you, say, so that if there's any problem, it's more say the edema wunye, okofa bibi fra problem be by near edeba. Finally, the mechanisms on the say sickle cell moja yare so edosun emma just nipa na owo yare no but nebusia eni oman afa oman ni nyina na sa yare in kind tetanus obi was sickle cell oni mbro 18 man say eni bi aba adesua so aba hwehwemu so aba e kire say a very normal life is possible with the yare no. As evidence, every Tuesday we see patients more than 60, 70 on mobile clinic. Into also where you're any be a death sentence. Say all hope is not lost at all. They here and say ube 200 among wako clinic and a hospital or offers our services or Accra. Be a patient say crave if Benin any Togo Sierra Leone into baby will be there's also another one in Kumasi, so you can go there or you can come to us. Some other hospitals like Rage 37 also Emma some offer our services into go to the nearest hospital. Ben we your bar so now in saying na or sickle cell say a doctor na you make sure say yetumi edi yeni edi wechi na bibia ebe fine say dem say ene mama makwenya say membra embekasa Ghana Institute of Clinical Genetics wo Kolebu Teaching Hospital ya wo Kolebu Polyclinic nechi so udu Kolebu now bisa polyclinic udu wa ebe to match our sickle cell clinic wo sickle cell branaye unrolling we need to me endi wechi na bibia enye. Okay, thank you very much.
Thank you very much, Dr. Kwabena Amoako. Yeah, that's a set with Nian Abeche, addition de Bebre, a fascicle so, and senior worker, any biaba, addition Bebre, aba, intimate nephew, and Maudiano engines, and Bomodia South Beco Hospital. And I, afraid for anyone who send messages, Ninara, Yeni, a somo Bebre, Yami Inshramo, Sabri, Yenim set Bebre, Egusu, Ara, Efre, Nemo Yamre no aso, Emrene be mayeni nyame ya adoma ne na otwen so ye dey another segments that would really inform us and so ebesan aba. And so thank you very much. This is WTV Consulting Room. Bia we have your free health consultancy on this show. Enti meme de bia 4:30 ekopem 6 p.m. This is Rose Aduful, your host for you for the period. Nyame ensure mo nyame ya adoma and then our che yebesa ehie mo have you. God bless you so much.